Empowercare is an interregional project in the 2Cs area, where the central goal is to empower people to manage their own care and their well-being in extension with that, such that they can live longer at home. So we focus mainly on elderly people. And we do this through different angles, and one is technology development. So we want to give them tools to manage their own care and with extension to manage their well-being. And these different technologies are being investigated from different perspectives. And we want to do this from the person-centered angle, personalized services and tools that we offer them, but also from the care settings that we want to train the workforce to help the people with that, and also from a community asset approach to help people or the communities in co-creation with the citizens to develop these technologies.
Thanks, Nathalie. And in terms of impact to date, what have been the major outcomes of the Empowercare project, and what would you say have influenced the success to date?
Well, the project started this year. So the outcomes are, of course, there is the corona crisis, which has a major impact on the project as we work on the health care and the well-being setting, and we need these people in our projects. Of course, their focus is now a bit on the other side. So the outputs are expected end of 2020. But the idea will be to have a blueprint for technology. So principles or basic ideas that we compose with a team of different countries, so different social and healthcare settings, so that is applicable in all these countries. So we want to develop a blueprint for these technologies to be used in a healthcare and well-being setting, so that it respects these principles of empowerment, of co-creation and participation. And that with these blueprints, we also want a strategy how to implement this in the workforce setting, in the community setting. So these are the main outcomes, a blueprint and a strategy to implement this.
Thanks, Nathalie. And there are many factors that will influence the success of a project like this, and you've spoken about some of these, but there's also a need for support mechanisms and government policies that will underpin a programme of work like Empowercare and I was wondering, are there regional policies and support mechanisms in Flanders that help preventive medicine initiatives such as Empowercare?
Yeah, so actually the support mechanisms is, for instance, yes, so as I said, we work with local communities for this. So they really help us to implement the project. As I speak of these technologies, one of the technologies is the bebop technologies, where we develop preventive tools to empower the people in managing their risk on chronic diseases and how to act upon this. And we work with the local communities because we really want to make it available to the people in their neighborhood. So we want them to be able to step outside the door and to really act upon their personal problems. So the communities help us in bringing this to the people, helping people on board in the digital technology, because that's not so easy. You need digital literacy, and they help us with providing support for that. On the other hand, there is also financial support we have from, for instance, the province of Antwerp. They help us with this project to realize this. And also the regional government, Flanders, is involved in this project with helping us developing additional applications on COVID specifically to help people, to extend our services to the people to help them work on their health.
Your project, Nathalie, there is also the involvement of the municipalities, the very local governments.
Yeah.
That's important to mention, I think.
Yeah, that's the first aspect I mentioned, that they help us to implement this and to bring it to the outside, help recruiting people and help people onboarding in the system. Yeah, so the local government, I called it that, but indeed it's the municipalities. Yeah.
Mm-hmm.
Within Flanders, there are several departments that are responsible for topics connected to prevention and to health in general. Maybe I can start with the innovation part of the story. There is the Flemish Science Administration, of course, where you can apply for funding for more fundamental research. That's one thing. But on the other end, there is also VITO, which is a Flemish agency for innovation where you can work together with companies and research institutes on specific topics, on specific projects. And one of these funding channels now, due to the corona crisis, is also the what is called the Cook funding mechanism, where we also have a project running at the moment. Connected to this, there is also the Innovative Company Network, which is a public-private partnership, one could say. So it is a collaboration between companies and the Flemish government, where also preventive research can take place with a higher TRL level. Then I think it is also very important to mention that there is the Department for Economy, Science and Innovation, which is making also the connection with the European level. In this context, we are working together with different regions, but we can come back to this point later in the context of smart specialization. And Flanders has chosen that preventive medicine, or personalized medicine, that's the correct term in this case, is one of the focus points of Flanders. And this smart specialization will probably, most likely, also go into the direction of a vanguard initiative. So that means that Flanders is indeed saying that also for innovation, prevention is very important. Next to innovation, there is, of course, the health agency or the health department, where prevention is a Flemish responsibility. You know that within Belgium, the responsibilities are divided between the federal level and the regional level, but prevention is one of the responsibilities of the regional level. So there is also a strong focus on prevention. And due to the recent crisis, this focus is increasing.
Thanks, Jeff. And in terms of barriers that are facing preventive medicine at the minute, what would you say are the major roadblocks facing preventive medicine, maybe at a European level and even within Flanders?
Maybe I can say a few words about the European level first, and then Nathalie can go into the details. Yeah, we believe that one of the major roadblocks is accessibility of data. When you're talking about prevention, you are talking about longitudinal data. You need to monitor people for a long time before you can make any evidence-based expressions about what is working and what is not working. And the need for this longitudinal data and very diverse data is a huge challenge. So we believe that something needs to be done to make this available. And Europe is, of course, taking a lot of initiatives in that direction. From our perspective, we believe that it is very crucial to have the citizen really centric in this kind of an approach, because only in that way you will be able to collect the necessary data, but also very importantly, it is necessary to have the engagement of individuals in this kind of an initiative. It has become very clear also in the recent crisis, the corona crisis, that trust is crucial when you want to make a difference with prevention and with personal data. And this is also something that we are implementing in some of these projects that Nathalie can probably talk about.
Yeah. So one of the things indeed that we are, as I said before, the central goal of Empowercare is to empower people in managing their own health and care. And in Flanders, we apply this by giving them tools to manage their risk for chronic diseases. That's what I said. And what we learn that the hurdles are is that there are multiple tools offering similar aspects, but people indeed sometimes think, which one can I trust and which not? Especially now, science is a bit in a crisis, you may say, trustworthy, fake news, stuff like that. So indeed, the evidence base is very important. People need to be aware that they have a tool that they can trust, that is transparent, that's easy for them to access, that shows that there will be an impact. And that's why we choose for our technology to go for a data-driven approach that is indeed citizen-centric. And that's what we are trying to do at a local level now, together with all local stakeholders, the municipalities, the mutualities, the local GPs, to make it the barrier of trust as low as possible for the people, but also to make it possible to access for everyone. So the digital literacy is very important when you are developing new technologies, especially in this era. Again, they are becoming more and more digital. It's important to acquire the necessary data, but not everybody can access them or trust them enough. So digital literacy is very important aspect also that we need to invest in the future to make it possible for everybody to access this, or at least help them onboarding. In Empowercare, we focus at the elderly. That typically is a group, especially the older people living in care homes, that need some kind of stewardship or custodianship for accessing these tools. And I think that these are the most important aspects that we need to look for, that it's evidence-based, transparent, indeed that people trust it and that everybody can access it. Yeah.
I'd like to touch on the interregional collaboration aspect of the Empower project. So interregional collaboration is something that the SAPHIRE consortium are working towards, and it's something that we believe is something, it's vital for innovation. And I know that within the Empower project, I think you mentioned you're working with partners across Netherlands, France and Belgium.
And the UK.
To ask you is, how has this benefited the project?
The main benefit of this will be that the strategy or blueprints that we are developing will be applicable in all these different settings. So we really want to develop something that's generic, that can be implemented in all these different areas. And I think that's the main goal. We all have these different care systems with their different characteristics and aspects. And by developing this in a consortium that's international, you immediately take this with you in the design of such a blueprint and strategy. And I really believe that that has a lot of added value for the future, and to when we want to scale up to a European level, for instance. Yeah.
Yes, indeed. I think this transferability is very important. By starting from the beginning in a collaboration with different regions, you can make sure that the things that you're developing will be able to transfer to other regions. That's one important thing. And another thing that is, of course, connected to this is the advantage of scale. Some problems cannot be tackled at a local scale, but need to be tackled at European level. And then working in an interregional scale is very important to make this advantage of scale really happening. Another thing that I think is important is learning from each other, also on business models. When you're talking about prevention, we also have to think about how innovations that are occurring can be implemented in new kind of business models. How the value that is created with prevention, because it creates value, but it's not trivial to collect this value. how this value that is created is distributed between different stakeholders and how this can be organized in the best way. And therefore, I think it is very crucial to talk with other regions to see how experiments that are running there can be implemented in our region.
So Nathalie and Jeff, I would like to thank you on behalf of the entire SAPHIRE consortium for joining me today for this interview, and I would like to wish you well with the continuation of the Empowercare project. Thank you.
Okay, thank you.